cared for several patients with Ebola virus disease now, and we've learned a great deal. Probably the most important thing we've learned is that it's something that we can do safely. We have not had any exposures, any concerns about healthcare workers, but it has reinforced the fact that, as Dr. Duchin said, we do have to be very on guard in terms of identifying patients promptly as they come to healthcare systems and using appropriate personal protective equipment as we manage these patients. We have to be much more aware that we don't only have patients coming back from West Africa with potentially Ebola virus disease. We have patients coming back from the Saudi Peninsula with potentially MERS. And we have other travelers coming back from other parts of the world where other infectious diseases not common in the United States are being seen. The critical component to caring for patients with Ebola virus disease is aggressive resuscitation, attention to fluids and electrolytes. And again, unfortunately, when we see these high rates of mortality in third world countries, we are dealing with facilities that do not have the kind of infrastructure that we have. You don't have to have a biocontainment unit such as ours in order to care for patients, because there is no airborne transmission, which is really the major benefit that our units give. Patients who have Ebola virus disease require contact and droplet precautions, no different from any of the other infectious pathogens that we as healthcare workers deal with on almost a daily basis. There are a lot of pragmatic issues with dealing with patients with Ebola virus disease which are yet to be worked out. Issues such as, if you don't have a special unit, where do you do laboratory testing? Issues such as, how do you reconcile public health recommendations about liquid and solid waste disposal with the practicalities of contractors and watershed departments that you may be dealing with. It's not going to be possible, if this outbreak continues in West Africa, for a select number of institutions to care for patients with Ebola virus disease. There are going to be more patients. Even the most optimistic estimates are that there will be tens of thousands of patients, and it is likely to represent additional patients coming back to the United States, and there is no way that the small number of institutions currently identified can possibly take care of all these patients. On the other hand, we and others are attempting to put out guidance which will help at least regional hospitals manage patients with Ebola virus disease.